13 coming in hot, so hot, so hot. How do you treat actinic keratosis? With topical 5FU, of course. If a patient, typically a boy, has severe obstructive uropathy, what should you do? Imaging to check for posterior urethral valves. How do you confirm urethral valves? Location. With a voiding cystourethrogram. In distal injuries of the tendons of the hands, knife fight, what's most likely to be injured? What sort of tissue? Tendons, I gave it to you. So tendons are more likely to be injured than the muscles, nerves, or the vessels, by the way. All right, so patients that want to be euthanized usually feel that way because of what rationale? Right, their sense of losing their autonomy and their sense of dignity is what is typically seen. If a patient, so as a physician, if you get a euthanasia request, what sort of a conversation should you begin? Like, what's a good statement to begin that conversation? Please tell me why you feel this way, right? All right. What is a rapidly progressive weakness of the lower extremities following an upper respiratory infection? Transverse myelitis, right? Right. If you have a child that's cutting themselves, what should you do? Notify the parents as they are minor and are at risk of self-harm. If you have a 35-year-old female with a lump in their right breast, what should they get? A mammography, since they are older than 30 years old. If you have a patient with paroxysmal supraventricular tachycardia, what would you see on the ECG? You would see narrow complex tachycardia with retrograde P waves. What would you see on an EKG of a patient with Wolff-Parkinson-White syndrome that's having a very bad complication of that syndrome? You would see atrioventricular reentrant tachycardia. Misclassification of exposure can result in what sort of bias? Recall bias, right? What sort of labs give away that a patient's having a helminth infection? Eosinophilia, with or without GI issues. And note that you should do a stool O&P in those patients. What is a quantitative measure of intra-observer or inter-rater reliability? The kappa statistic. If you note a subchorionic hematoma early on, what should you do? Continue with expected management in a pregnant female. There is increased risk of spontaneous abortion with a subchronic hematoma. That should be obvious. If you have a patient with a bad asthma attack, you should consider an aggressive inhaled beta-2 adrenergic agonist therapy. Okay? And if the patient's having a very severe asthma attack, what sort of intervention should you consider? Intubation, right? What sort of overall health risk are patients with acromegaly at increased risk of developing? Cardiovascular disease, right? How do you sort of account for effect modification in a study? With a stratified analysis. Traumatic brain injuries can result in what? Post-concussive syndromes, right? Typically, what artery supplies the lateral wall of the left ventricle? The left circumflex artery. True or false? Metoclopramide is a central and peripheral D2 receptor blocker. That's definitely true. And note that metoclopramide's use can cause extrapyramidal symptoms like dystonia, akathisia, and dystonia. Note that severely depressed patient that needs urgent treatment can benefit from ETC even if they're pregnant, right? Right. What's the most common bug found in a cat bite? Pasteurella. And how do you treat? Amoxiclav. Elderly women with asymptomatic bacteria need what sort of intervention? Trick question. Right, since it's an elderly woman with asymptomatic bacteria, they just need to be closely monitored. How do you diagnose adjustment syndrome? If they have 3 months, like greater than 3 months with an obvious stressor. Is it 3 or 2? Look into that. Anyway, how do you treat rosacea? What medication? Topical metronidazole treats rosacea. What sort of other symptoms could a patient with rosacea get? Ocular symptoms. What does so slowly progressing cases, what sort of bias happens? Length time bias. And note that if a patient has some eye issue, that it would, and they have pain, consider orbital cellulitis. You want to get a CT scan of the orbit and sinus if you suspect pain with orbital cellulitis, by the way. And how do you treat orbital cellulitis? With IV antibiotics in the hospital. That's how. True or false? Sulfonylureas and meglitinides increase insulin secretions, and that can cause hypoglycemia. That is definitely true. Benzodiazepines such as lorazepam in the elderly increase the risk of falls and fractures, right? Right. If you have a benzodiazepine like lorazepam withdrawal in the patient, what sort of symptoms are they most likely to have? Shaking and seizures, right? So, how do you want to manage that? Well, emergency treatment with a short-acting benzodiazepine, like diazepam, would be helpful. For a rock curve, sensitivity and specificity, high ones are where? In the upper left-hand corner. What is the best way to decrease weight and hypertension risk? Weight loss. Trick question. And regards to general basic things, advise the patients about safety and where they're wearing their seat belts. Okay, that's 13.